2020 board meeting to order. Will the secretary please call the roll?
Ms. Manser?
Here.
Mr. Abarca?
Present.
Ms. Cortez?
Here.
Mr. Hogan?
Here.
Dr. Jones?
Here.
Mr. Wasserstrom?
Here.
Ms. Wolsey?
Here.
Thank you, everyone. In order to approve the agenda, I am going to request that one of my members make a motion to amend the agenda. And I'll explain the amendment. We were expecting to have a presentation in superintendent closed this evening, but that presentation is going to be provided to us at our next meeting. Administration needed additional time to prepare that presentation. So it would be in order to receive a motion to amend the agenda to remove superintendent closed items and leave all other agenda items in the order in which they appear.
So moved. Second it.
Thank you. It has been moved and seconded. The secretary will please call the roll.
Ms. Manser?
Yes.
Mr. Abarca?
Yes.
Ms. Cortez?
Yes.
Mr. Hogan?
Yes.
Dr. Jones?
Yes.
Mr. Wasserstrom?
Yes.
Ms. Wolsey?
Yes.
Thank you. So the first item on the executive session this evening are the superintendent items. So I will turn this over to Dr. Bedell.
You're muted, Dr. Bedell.
I'm sorry. Okay, I was flowing pretty well too. So let me start over and say, first of all, hello to everybody, board members, staff members, and any of our community members that may have logged in. I want to get started with the town hall proposal. As I've shared with the board officers, I've been in a number of conversations with different community leaders, and we had already started having this conversation around, do we need to do some kind of community town hall meeting with different leaders from different sectors over major areas to try to update folks on what we're doing in our respective spaces. But then Daryl Davis approached me with the idea too around as a district, did we want to look at doing something? And I said to Daryl, I think it's a really good idea. And we were thinking around the format of it, where it would be myself, several cabinet members that are responsible for some of the key areas, allowing for our community to log in, to fill, to provide questions in the text area, the chat area, and to get a feel for how people are managing all of this, to update them on where the district is from a professional development, a digital conversion standpoint, connectivity standpoint. What are we looking at potentially doing for the fall, given what's going on right now? What are our options that we're looking at? What does reentry look like? So beginning to have those conversations with the community, and in sharing this discussion with the board officers yesterday, they felt that it would probably make a lot of sense if we were to try to do this potentially with other entities, or even have other entities be a part of what we're doing, so that we can have a larger audience that we would be able to tap into. And so I love the idea. One way or another, we are going to look to do it. Daryl has logged in, and I wanted Daryl just to, it's not much you need to do at this point, Daryl. I've given them everything, but my thought is, Daryl, do you think it's something that we could do before the month of May expires? Because we know summer school starts June 1st, and I just want to be realistic about us being able to put this together and get people on board, or, I can have this conversation with Gwen Grant and some of the other leaders that we've been meeting with from the health department or other different entities to be a part of this conversation.
Hi, good afternoon or good evening, everyone. Dr. Bedell, yes, I think we can pull it off. We set a tentative date for Thursday, May 28th at 7 o'clock p.m. And the panelists and participants are already ready to go because it's primarily having a discussion around all of the work over the last couple of months. And I'm sure Gwen Grant or any other partners that would be invited would be able to freely speak to whatever they've been working on, as well as collectively and in a collaborative sense, looking forward to how things will change in the future as a result of this COVID-19 and the likelihood that it may come back.
Okay. All right. So that's good to hear. So we already have a tentative date. I knew Daryl was working on it, and I wanted to just make sure that if there were any questions or any ideas or suggestions, we'd love to hear those now before we move on to the next topic.
Hey, Dr. Bedell, I first applaud this effort completely. I think, as I mentioned in the exec meeting, this is a great idea for many, many reasons. I was in a discussion with a colleague here locally, and he had suggested that you consider a task force on innovation about how we can start redefining what public education for KCPS may look like post-COVID. So that's something that you kind of is along the same lines here and maybe forefront, but we could take a great leadership opportunity here in driving the regional approach, that type of task force with community leaders and stakeholders and all. So another element to that you may consider.
Manny, you hit that on the head. That was part of wanting to do this town hall, was to also say to our community, like, let's be very clear, our system hasn't, for many years worked, for 70 to 75% of our kids, and we all have an opportunity to reimagine and redesign what this could look like and how this system could better serve this community, from a social, emotional, and educational development standpoint. So yeah, I love that thought process. That is ultimately where we want to go. And I also feel that it's all timely, right? Because even with Blueprint 2030, there's a lot of this stuff around what we believe we need to do can be interwoven into the decisions that we have to make around how do you restructure, redesign this system. You got data, you got COVID-19 that's basically telling us that things aren't going to be normal as they have been in the past. So we have a huge opportunity here to look at so much. So I love that. I love that.
Can I add something? This is Jennifer. I love the idea of this. I thought at first when you were, I like town halls when they are circular, meaning there's some back to us, and I don't know what if this is meant to be a unidirectional kind of town hall, but I have been getting a lot of just input from parents and some students about how they've experienced the transition. And I know that many of them want to express to us what they've learned, what has been good, what has been not good, and so that we can know.
Yeah.
So I don't want to try to bite off too much, but I don't know if it's a series of things. And because you'd really want to set it up so people could properly give, some feedback that's useful. There's probably a little cathartic element to that as well for people to feel that you're hearing what their pain points have been.
Yeah.
So just that's kind of my 2 cents. I love the idea. I just want to make sure that we're not just plugging away going forward with no input from the sides, the parents and the student, or the guardians and the students.
Yeah, absolutely. I mean, I think that's the purpose of this too, to gather thoughts and get some input. And we had also talked about, do we look at some kind of survey to get some feedback from our parents? But I also know the survey fatigue thing
is yeah.
Right, it's just
They
a
need
killer.
to vent. I think people really need to vent in a way.
So Dr. Bedell and Ms. Wolfsey, one of the things that we've been talking about and with Dr. Bedell and even with Dr. Davis and our team is, we've employed Thought Exchange as a crowdsourcing platform that we want to use for Blueprint 2030 coming up here in June and July. However, it would be a really wonderful platform if we want to gauge some crowd feedback regarding distance learning, how it's been going. And we were kind of thinking about doing that maybe in conjunction with this town hall to provide that other platform for folks to provide feedback. Because like you, we've been talking about in the professional PR school arena, how are you gathering feedback from your parents, your kids, your staff about how it's been going, positives, challenges, all of it. And we need that as we launch into next year. So we're right with you on that need to get that launched.
All right, good thoughts. And I know Daryl's taking all of this down. So as we think about how we will move on about the format of it and trying to make sure that we can get information, I will be very clear. I'm not interested in this being an attack session. I mean, we all, because it's the thing I have been saying to everybody, everybody's trying to figure this out. We want feedback, but I'm hoping that we don't have people that are rude and doing inappropriate things that will ultimately hurt what we're trying to get out of everybody and turn folks off.
Dr. Bedell, we have discussed making this a series, setting it up in a way that we can have follow-up discussions as additional topics come about. And you mind if I just share this screen real quick?
Yeah, go ahead.
Okay, let me, and then the week of, so maybe on that Monday or Tuesday, I'm trying to find this here. We're going to have a prep session for those participants. I think this is it here. So on that Monday or Tuesday, the week of, we definitely want to prepare whoever those community partners are, as well as our internal folks, to just make sure we're ready to have this conversation with parents and stakeholders and community members being on the line. Many times people will judge us by our language and they see it as a way, how we think or believe about kids. And so you just want to have a conversation to make sure that we don't use, say, any deficit language.
Right, exactly.
Terms such as differently able, are taken far better than disabled. And we'll have, a list of those type of topics we'll talk about in that Monday or Tuesday prep so that it's clean and it comes from the right place. And so we want to, as much as possible, focus on the system rather than the individual students or families, but more so the system that has kept our community marginalized, the families that we serve, similar to what Dr. Bedell was just sharing. And so we'll talk a little bit about that on Monday and Tuesday so that we frame it in the right way, our discussions as we look to close gaps and improve the system.
Great. All right. Do we have any other feedback? If not, Madam Chair, I think we're ready to move to the next topic.
Yes.
All right. So we're going to pass this over to Dr. Collier, who's going to give the BOE and non-school-based staff reentry plan. So we want to go through that. It's about 5 to 6 slides, but it's pretty important stuff around what we're trying to do here as we look at trying to bring employees back into the workspace.
Good evening, everybody.
Good evening.
Let me share my screen really quickly. Okay. All right. Can everyone see? Is it?
Yes.
Okay, perfect.
Pretty proficient with this now.
Yes, I'm getting good. A lot of practice, that's for sure. So this evening, I'm just going to give you a brief overview of the Board of Education staff. This is non-school-based staff reentry plan. And I asked June if she would send a copy of the actual plan in its entirety to you so you can take some time to review it. And we would love feedback. It's very important to note that this is still in a draft form. We have gotten feedback from most of our departments. However, people within our system are still providing feedback. I received some feedback even as late as recent as today. So this is a living document and it's continuing to grow and to change over time. So the goals of the reentry plan, we want to make sure that if our employees are to return, that we provide and establish clear and guidelines and expectations around social distancing, use of personal protective equipment, and then also safety practices. We want to make sure that it's very clear for our employees and that we've established those guidelines and everyone has an understanding of what they are prior to our return. We also want to make sure that we mitigate the risk of the spread of coronavirus at our work sites. We know that, and I'll just say right off, we know that there's no 100% guarantee given that there's no vaccine at this point. And so what we're putting in place is a plan if and when we return. We recognize that we may have to go with the option of continuing remotely. However, if we do reach a place where we feel it's safe to return and we need to, we will have a clear plan already outlined and in place and ready to execute. So the locations that we're referring to with this particular plan is our Board of Education 2901 Truce location, also Satchel Page, where our security staff, food service, facilities, and other folks are located, and then also Manual with some of our instructional staff that's located there. CIPD, I'm sorry, not CIPD anymore, but our SPED folks are still there, and some other people who are in that building. We want to make sure there are clear guidelines for them as well. So once again, it's important to note this is a living document. As we get new information, not only from departments within our organization, we're also continuing to look at public health organizations who are continuing to disseminate information around safety and recommendations around reentry. As we get that information, we will continue to update. So this plan can look different tomorrow, depending on the information that's coming out. I will say that CDC is one of the organizations that is just about every day producing new information and guidance for people around COVID-19. And they've done that consistently since the onset of COVID-19 here. And so we rely heavily on CDC guidance. Also, once again, a phased return will be contingent on the progression of COVID-19 in our community. So we'll have to continue to watch to see if it's even safe to return. I got the question yesterday around criteria. And so that's something that we had talked about in general, but we hadn't actually created criteria. And so what I did is I went out to find the most recent plan, and that was the White House CDC's Opening Up America Again guidelines. And quite frankly, this was probably the clearest guidance around setting up some type of gating criteria or determining whether we should return. And so it's broken down in two components around symptoms, monitoring symptoms of influenza-like illnesses and also COVID-like illnesses, and then also actual cases, and looking to see if there's been a downward trajectory of at least 14 days. And so this is one of the pieces of criteria that we'll use. Also, if you note at the bottom of the graph there, the chart, we'll also consult the Kansas City Health Department to get guidance on reentry. And then we'll also continue to monitor the progression of COVID-19 amongst KCPS staff, because we are monitoring as people report symptoms or report cases. And so we'll continue to look at that to see, are we seeing increases in our staff members as well? So some of the, I'm sorry? Oh. Some of the informational sources that we reviewed, MSBA pandemic recovery considerations, and I put in bold the ones that we are looking at using most closely, and that is the MSBA pandemic recovery considerations, and also Centers for Disease Control and Prevention information that once again comes out daily. But we have been looking at lots of other resources, and I have to give credit to Sarah Williams, our HR attorney, who's been the person in our department who's actually gone out and is gathering all of this data almost daily for us and bringing it back and highlighting for us, and we're talking through it. And so we have looked at a number of resources. This is not an exhaustive list here, but these are the ones that we have primarily used in order to inform our reentry plan. In order to reenter, we know that there's going to be some pre-reentry preparation needed. And so some of what we're requiring is thorough sanitation of all the buildings and office spaces prior to the staff returning. We want to make sure that we have ample protective equipment for all staff members. And so that would include masks, making sure that everyone is wearing a mask. People they may opt to bring their own. However, we will have some on site available. We will have all of these supplies available for staff members. Sanitation wipes. So when, if and when employees go into a communal area, if they go into a break room or they're going into the cafeteria where sometimes people would have lunch, they're wiping down those areas if they use them. Also the infrared thermometers so that we can check temperatures as staff is arriving to the building each day. And we'll designate staff every day to cover that task. We're also looking at, for congregational areas, making sure that we facilitate proper social distancing by arranging chairs and equipment in those places where people might use to gather. We're not encouraging gathering, but if people are needing to eat lunch in the area, our cafeteria is pretty large, and later on in the document, you'll see where we have some occupancy standards around how many people we would allow in those spaces at a given time. But once again, making sure that the seating in those places are arranged to help facilitate that social distancing that we're wanting to see. Also signage. We want to make sure that we have signage all around our building, reminding folks of the safety precautions and procedures that we have in place, just visual cues, just to remind people about washing hands and things like that. Also, training is going to be very important. This is a trend that we're seeing more and more in the literature that's coming out around reentry, how important it will be to provide good training for staff members prior to their return. And so we're going to be, HR is working now on creating a training module for our staff members that will be returning, that they can review it and cover all that information prior to our return. The other piece that we just recently started working on is trying to arrange on-site testing location. I've spoken with Nicole Collier-White, who's actually working to help set that up for us. So in the case that we do return, that we can also provide some on-site testing and make that available for our staff members as well. So our proposed return plan, we're looking at July. We know that we are a part of phase 2 of the governor's reentry. And so that puts us at about July for the time that we would come back. And so it's important to note that we're going to phase in groups. And as you can see, those groups are about 2 weeks apart. But it's important to note that as we phase in, and you can see which team members are assigned to each group, we're primarily starting with our leaders in the district for Group A, and then the next level of leadership and administrative assistants, and then all other staff in Group C. But as we phase in, we will also be doing staggered work schedules. So those two things are happening simultaneously. So everyone who phases in Group A will not be there every day. And so if you look at the sample schedule, some people would report to work on Mondays and Wednesdays, and others Tuesdays and Thursdays. And we've also decided that if we return in July, Fridays would be a work remote day for everyone. No one would report unless they're just needing to go into the office for something on their own, which they probably won't if they've already been in a couple of days out of the week. And then the plan is to resume Fridays when we hit August. On the days when teams are not physically reporting, they are still expected to report to work remotely from home or wherever, unless they have requested a PTO or vacation day. So these are just a couple different options for actual return. But then once again, I want to note that we recognize that it may be unsafe for any type of return. And once again, we'll continue to watch to determine whether or not reentry is safe and whether we should do that. But the one thing that will probably still continue to happen if we are unable to return, the staff members, particularly leaders, are still reporting to the BOE periodically. I know some are coming almost every day, but others of us are at least coming once a week to take care of items that we can't take care of home, like checking mail, because we want to make sure that things are not falling through the crack and that we're missing correspondence. So we do try to ask all leaders to come to the office at least once a week to check for things like that. If they need to scan items or take care of other business items, they can do that as well. And so some of the safety practices that we are focusing on, the pre-screening, once again, that's around checking the temperatures of employees as they're coming in. We're also asking employees to continuously check their own temperature and report if they have COVID-like symptoms or have had exposure, and all that's spelled out in the document that you have, a copy that you have. Also, PPE and sanitary practices requiring masks to be worn. We have gotten questions about whether folks can take off masks once they get into their workspaces and their offices. And I certainly understand that concern. People have complained about glasses fogging up and things like that. I will say for me personally, it's a challenge to keep the mask on the entire time when I'm in the building. It gets rather hot for me and I prefer to take it off. And so we're having a discussion now on whether that's even appropriate or not to be able to take off the mask in your private working space. And maybe perhaps that can be done if we are social distanced enough. But once again, we're continuing to have conversation around that. Also information around hand washing and whether or not gloves could be worn. That's the other piece that comes up quite a bit, whether or not we should focus on wearing gloves or not. There's mixed data around gloves. There's information out there that says it causes a false sense of security. It often causes lots of cross-contamination in using gloves. So what we've recommended is using gloves for particular tasks. Like if you're needing to change trash, which most people wouldn't need to, but you never know, you may have a case where you need to, or you're checking mail. Because we know COVID can be carried through paper items as well. Certain tasks using office equipment, if you're using scissors or I don't know, anything that could possibly be a shared item, using gloves for those cases. But in most cases, we're trying to make sure that people won't have to share items when they return, making sure we have everything that we need. But in the case that we have to share an item, then we want folks to wear gloves. And then also like the social distancing, disinfecting and cleaning workspace. It's important to note that we believe this is not just the responsibility of our custodial team. I mean, of course, they will do the lion's share of that, but we're asking everybody to clean and disinfect their workspace in the morning when they arrive, and then once again when they leave. And then also in any communal areas that they use, really wiping down those areas, keeping those areas safe for everybody. And then we have information, I won't go in detail on all of it, but also visitors to the Board of Education. We are discouraging visitors. However, we know that from time to time, it may be necessary to conduct business and to provide good customer service. In those cases, though, we're asking that employees notify that visitor of our safety procedures and the expectation that they follow them when they're in our building. And we will also supply masks and gloves and things like that for visitors if they don't bring their own. But once again, we're discouraging visitors in any case. And we're actually asking all of our staff members, even meetings, even if we're physically in the building, to continue virtual meetings. So from our offices, we wouldn't come together in a room to meet if we can avoid that. And then traveling, there was a lot of information initially about international travel. However, as cases increase in domestic travel is also a major concern. So we're looking at guidelines around that. What the CDC says currently is if a person does travel, they should have 14 days from working from home and symptom-free before they return to the work site. So those are guidelines that we'll be following in the case of travel. And if anyone is doing domestic travel, I mean, we'd like to know that, and it's not something that the district is supporting with district funds, because right now we're discouraging that. I know for most leaders at cabinet level, we have canceled all of our travel and meetings that we would go to. So I'm not sure why anybody would be traveling for the district at this point. But in the case that happens, we do have guidelines for it. And then just getting into the different departments, most of the departments have weighed in and given feedback, and there's a more extensive list in the document. But for human resources, one of the things we're working on is a procedure for those who are in high risk groups, who have underlying health conditions or maybe age, working with them to request work from home accommodation. So we want to make sure that we're keeping our employees safe and not requiring folks to come in if they really should not be coming in. And so that's going to be that interactive conversation that HR has with those employees to help work out those accommodations. Facilities developing floor plans, looking at all of our floor plans to determine if we have social distancing guidelines met by those. Communications, continuing to disseminate information to our staff, and they've done a great job of that already, but just reminding us of our safety procedures that we have in place so that people don't forget and don't get comfortable. Business and finance, we've already started doing this, looking at our budgets and how we can adjust those so that they reflect our remote work status and price demands. Safety is working on emergency evacuation procedures that will take care of social distancing requirements. We don't think about that often, but if there's a fire drill, we can't go outside and all stand in a group, which is what we would normally do. We would have to also follow some social distancing guidelines there as well. So they're working on those procedures. And then custodial just with creating clean protocols and schedules. So these are just some. It's like once again, in the document, you'll see a lot more information, but these are the areas that we're looking at and we're continuing to add on as we get more and new information. Any questions?
Are there any questions?
Patty, I've got,
Nate
sorry, I've got a quick
or Rita?
question.
Sorry.
It's really around, there's two areas. One is kind of what's the strategy for monitoring the effectiveness of the program? And how are you planning to kind of report that up to Dr. Bedell and ultimately the board? And then the second is, do we have a sense of what the time lag? I mean, I know that we have some time markers in there about the 14-day curves. Do we have a sense of what the time lag is in terms of the data that we can get about that testing? I mean, is it a week behind? Is it a day behind? How fresh is the information you're able to get? Well,
initially when COVID first started, it was taking like 7 days to get responses back around whether a case was positive. And I think we saw that in the instance with the food service worker where it was believed they were presumed positive and we had to wait a few days. And that was part of our dilemma there, is that we really didn't know we were in that moment of limbo. But now we're getting information back within like a day or two. Like testing has improved, or at least the type of testing where we're getting confirmations back of negative or positive a lot sooner. And then in terms of strategy for monitoring the effectiveness, as folks are reporting to our employee relations department, we do have a form on our website at this point where people can report so that it doesn't have to be any in face-to-face contact. But if we begin to see cases, more and more people reporting illnesses, I will immediately share that data and that information with Dr. Bedell and the cabinet. And at that point, we would have to then make a decision on whether or not we want to even continue with in person. But that information would come through our employee relations department where people are currently reporting now.
I have one comment that I wanted to make for everyone, for the board. Just as the administration is working through this reentry and safety plan, even as we are doing our work right now as a board, we have some of us like to come here because we need to obtain material or there's some kind of assistance we need. So because the direction from the administration is for people to be working remotely and to adhere to safe practices such as wearing masks and being respectful of common spaces and kind of watching that, you know, how and where you go within this space. The board workroom is here for use to handle work related to board business, but we are in keeping with what the administration is trying to achieve around safe spaces and social distancing. The request is that every board member, prior to making plans to come to the Board of Education building, to notify the board secretary that you will be coming, and also to wear a mask upon entry to the building and until you get into the board workroom space. So just for example, I'm doing this board meeting from the board workroom this evening, but I notify and touch base with both the board secretary and also make sure that the superintendent is notified so that I can determine if there's any concerns about me being here. And then I come with a mask. I'm not wearing a mask during this meeting, but I'm in the room with the door closed. So that's just a request going forward. So for board members who have a need to use this room or to get assistance from anyone through administration, we're asking that everyone please check in first with the board secretary. And that way we're kind of honoring the people who are also working here during this time. Are there any other questions on that?
Hey, Madam Chair, I know Dr. Jones, I don't know, she typed some stuff in the chat box that I thought was pretty important. One around exactly what you just said, which is guidance for workplaces is to wear only in common areas. And then once you get to your office or area where you're not around a bunch of people, you definitely are free to take the mask off. She also in here talked about because of the context here in Kansas City is likely different from other areas. And we know right now that our city is one of the areas that is has been labeled as an area to watch from the federal level as in terms of cases and what that count would look like as they continue to move forward. One of the things she was saying is it's important to remain in touch with the local health director also for consultation. So I just, I think some good input in here that we also need to just take into consideration.
Yeah, thank you. Are there any other questions about the administration's proposed reentry plan? All right.
It's not related to this reentry plan, but I think the next thing up is going to be enrollment. And so I assume that's going to be the next thing you think about is how we would handle enrollment. I don't expect anything on it tonight. I just want to know. I saw Dr. Bedell shake his head, so it's on the radar.
Yeah, we actually have a, we've already put a task force together to start looking at. It's not even just it's everything enrollment, right? It's going to be that part. It's also going to be taking a look at our enrollment procedures, our enrollment policies. So I do want the board to know that was one of my things I was going to give you in this just this quick other business items and announcements that we already are starting to work on a task force and they already started meeting and we'll be providing you all with some updates on how we're progressing as it pertains to enrollment and even some of the things that we've learned on these surveys and what we're hearing from our community.
My question was, or comment was more related to, we're so used to our families coming that physically, that in mass in August.
Yeah.
And I just don't know how that whole thing transforms itself given COVID. So that's really what it was related to COVID and that physicalness of coming in mass. So you don't have to figure it out now. I just know it's a big part of what we have to deal with.
Okay, sure thing. I also wanted to say too, as we're still on this topic, well, we're moved into this next area, but we did have on-site testing today at Northeast High School. So we will await the results from the individuals that were tested. Wanted to also let you all know that the state board approved for an earlier school start. So they waived the August 24th start date. So that's something that I think we need to really consider taking a look at. One of the things that I learned from the superintendent out in Omaha is she presented to her board 5 different calendar options and they approved all 5 of them. In the case of if something happens in the fall, we are able then to execute on this particular calendar, or we can execute on that calendar. And I thought it was a great idea just because of the unknown. I think for us, we got to figure out how do we have flexibility as a full team here to be able to pivot and make adjustments as needed. And I think it's something that we have to think about. If we know right now we have an opportunity to start school on August 3rd, or if we decide we want to start it on the 10th, we have some flexibility here, but it would also then require that there would have to be some calendar discussions. And it also would require us having conversation with Andrea and making sure that membership understands, what we're trying to do. So I do have a scheduled meeting moving forward with Andrea every Friday to begin to have more of a conversation with her around just as things change, like what just happened yesterday from a school start standpoint. So I wanted to just update you all on that, and our team will take a look at, how could we potentially leverage starting earlier, and do we have the ability to pull it off. So those are just some of the conversations that I wanted to share with you. AMI, alternative method of instruction. So in order for us to have the ability to be innovative and to think outside the box and to do things differently, I feel like the state right now still has not kind of given us this definition of what alternative methods of instruction should look like. If we want to go to a whole different way of how we conduct grading, or, how we get credit for ADA based on, other different kind of models. And I did ask that question. The commissioner said they have a focus group working on it right now. So, I don't know where we are with that, but the thing I have said to several of the board members that's on this call is that in many cases, I think it's contingent on us. We got to figure out how we're going to best serve our community. It's just that simple. And then go to DESE and say, this is what we've all come up with that we believe will allow for us to do the best, the highest level of service for our kids. And that's pretty much where I think we have to go with this. And so just knowing that, we all can agree that that's probably the way that we need to do this, we can then begin to move and have some deeper conversations about, reimagining what education looks like. And it sounds like there's an appetite from this board that we need to take a stronger look at that, which I'm really happy to hear based on my conversation with the officers yesterday. And then, Madam Chair, before we go to legislative update on the announcements, did anybody, just with those few updates I just gave, had any questions or any thoughts or anything?
Go ahead, Rita.
Dr. Bedell, the one thing I would encourage you as you think about alternative methods and kind of sharing with us the directions that your team starts to evolve, is to build into that discussion methods of assessment.
Okay.
Just so that we understand kind of the ways that we can and we can't assess student progress in the rethinking of the universe.
Okay, thank you. Got it.
Other questions or comments? Dr. Bedell, I have one quick question. I was really pleased to see the State Board of Education take that action yesterday, giving the commissioner that authority such that we can make an application to change our start time. I think does our flexibility, if we do that, if we should make a decision because our students, if we wanted to begin the year a little bit earlier than otherwise mandated, does that flexibility allow, if we should, society and illness should cause us to have to pause again, let's hope that does not occur. But if for some reason at late September or October, there would be a necessity to pause, does it allow that kind of flexibility to stop, like you would jump to distance learning, I'm assuming? We could have that kind of flexibility to go adopt an alternative approach and then return to school when it's safe.
That's correct. Absolutely.
Okay.
That's the reason why I think it's important that we try to build out all three options. While you try to reimagine what we can do differently, if we come back traditional, or, you have the hybrid model of virtual and traditional, kind of like what Dr. Collier shared with you all, how you would have half of the employees in on this day, could be a model like that for students where half are in and half are off. And then, or if it's 100% virtual, but having that flexibility, the AMI will allow for us to do, I think, exactly what Ms. Cortez just asked around, what are the methods of assessments that will be acceptable if we have to go a different way of looking at how we can judge whether or not our students are learning and that they are able to, demonstrate that they have mastered the standards that are being taught. But AMI would give us some parameters around what we could do and or not do. But I think we have to, when we present what we want to do, already have in our mind, here's how we want to assess it. But that's that flexibility piece.
Thank you.
All right, absolutely. Legislative update. I was gonna figure out if that was Linda or was Miss Wolfsey going to give us an update
I
on
think
that.
Ms. Wolfsey is prepared to do
All
that.
right. All right.
Under superintendent stuff. So right now we're watching 1540, which is actually on the calendar. So it can come up at any point in time. I don't know if like me, any of you guys keep the Senate and the House up on your screen so you can constantly be listening to the dialogue, but it's been pretty fascinating. Right now, it's not coming up. We are being told that the Recovery Charter High School may come out in a Senate substitute. We'll see. But, you know, we can always have it offered back up as an amendment, which would give it the chance to pass. We also have some intel that we do have some senators that are willing to help us if it does make it to the Senate floor. So we have tomorrow and Friday to essentially hope that the pressure that both Linda, Dr. Bedell, and John Barget, and Patty, and Rita, and the team have been putting on various folks. They are feeling it down in Jefferson City, which is making them a little leery to bring up some of these bills. So we need to continue that. I mean, just kind of keep an eye out, keep an ear out, watch your text strings, and cross your fingers and say prayers that we make it through these next 2 days.
Thank you.
Jennifer, are you going to give any kind of update on HJR 77?
I was just going to ask Linda, that I can do it, but I'd like her to back me up on it. So that was over in fiscal review.
And remind everybody what HJR 77 is.
Sure. The HJR 77 was Representative Eggleston's bill to essentially look again at property tax. The most concerning part for us was the cap. But through, you know, again, pressure and the work that they did kind of, I wouldn't say behind the scenes, but it got moved into fiscal review from a lot of people asking about the question on the auditor, you know, what would the actual rate be itself, and the legal question about, you know, unseating a DSEG case, a federal case. And so they pushed it to fiscal review, asked the questions. There were enough concerns in fiscal review that it was voted down 7-2. And I think, Linda, if I'm not mistaken, somebody could always try and go talk to one of those members of the fiscal review committee and get them to maybe reconsider this. But they've run out of time, and really they would have had to change, you know, 3 people's votes to actually get that to make it out of fiscal review, which is, I don't ever want to say anything is unlikely, but that's a lot of work in these last 2 days. But that's an update on. Did I miss anything on that one, Linda?
No, you're absolutely right. The only real opportunity on 77 is what you mentioned, that some of the fiscal review members are talked to by Representative Eggleston and change their position, or that he finds another HJR to try to amend it to. But at this point, constitutionally, it not standing alone is very unlikely it would make its way out of review also. So like you said, we need to get to 5 o'clock Friday.
And we're so close.
I'm knocking on wood.
Yeah, I would imagine that the hours spent, I mean, I get communications from Chris Ropey every day of the week in some crazy hours. I don't necessarily actually see them when he sends them all the time. But the work that they are doing for us in Jeff City this year, I told Dr. Bedell earlier, is worth about 10 times what we're paying them this year, just because of the positive result and what it means to us, because some of this legislation has been so potentially harmful. So I'm ready for Friday to get here.
My other one thing I will say, and I was part kidding, but I have been watching at night some of the hearing committees. And because I guess we've had to do this because of COVID and they are taped and now recorded up there for us to watch, it's been very informative for me to listen to the hearings, because I can see the dialogue between senators and between representatives, and it gives you more insight into their thinking. So that's been an upside.
Thank you. Dr. Bedell, do you have any other updates under your business items announcements?
No, Madam Chair, that concludes all of my updates.
All right, great. So we will go to board chair open items. And the first item I have on the agenda is just a quick walk through the Missouri Open Meetings and Records Law, and specifically regarding the kind of the separation of the work in that realm. Bill Thornton, the attorney, is actually the custodian of records for Kansas City Public Schools. And so as individuals in the community, or if a board member should make a sunshine request, that request needs to be directed to the Legal Services Office. Given that the Board of Education and the staff here, all leadership and all administrative staff, are for the most part under a directive to work remotely from home. Obviously, people are coming in and out of the office, but in general, this is not a fully staffed building 5 days a week as we see during normal times. That means that those kinds of requests, when they are either mailed to or delivered to the board building, it is not necessarily the case that it would be seen immediately if something should be delivered to the board offices. So meaning our board offices, not the general building. So as you think about how you make requests and the kinds of things you bring forward, it's important to know that custodian of records is Legal Services. The 72-hour requirement for the response starts when the material is received by Legal Services, not when it is delivered to the board workroom. So we had a situation this week where a sunshine request was made, but it was delivered to the board services room. And we do not have the board secretary here 5 days a week, 40 hours a week. So this is a reminder to board members about what is happening. This is an unprecedented time. This is a pandemic. And so the staffing is a little more intermittent than you would see on normal times. For us as board members, the first thing I'll say is that if you have a request of information that you want, the first, suggestion is to always bring your request forward to the superintendent or to the board chair for the specific information. That's always, an easy and first avenue. And then the administration can accept that and process that. If you are intending to do a sunshine request, it is recommended while we are on a schedule here at the Board of Ed where people are not here, to notify the board secretary or to notify Mr. Thornton so that they can be looking for that material. So I wanted to walk through that. Are there any questions about that? So that is on, that item. And I think just one closing remark on that, just keeping in mind that June Kolkmeyer is coming to the Board of Education building with frequency, but again, she will not be in this building 40 hours a week. If you have a request of her, if there's materials you need from her, if you send an email and request that, she will absolutely make that material available to you or connect you to the assistance that you need. So just know that June will not be here 40 hours a week at this time. The next item on the board chair open is MSBA Leadership Summit. The Leadership Summit, I've mentioned this to the board previously. It will be remote this year, and it will be held on one day, which is Friday, June 19th. And that Leadership Summit will all be done, virtual by Zoom. Because they're not having it in person, typically they would do a 2-day conference, but because of where we are, it'll be all held on one day, and June's got the agenda up so you can see it. It'll start at 8:30 in the morning and it'll go until 4 o'clock. I'm not sure what social time will look like from 4 to 5, but it'll go till the conclusion of the business day. The cost is very low. It's only $99 a registrant. There at this time, Nate Hogan, Jennifer Wolfsey, and I am planning to participate in that. But we had, a lot of us were not able to participate in conferences this year that we had hoped to do because everything was getting canceled. So we want to make sure that any one of us on the board who is interested in participating in that conference to notify June, and she will register you. Let's see, the next item I have is, it's labeled somewhat oddly, board secretary request, but one of the things that June has been working on, I think because lots of us on the board have been urging this, is she is sort of virtually filing on Assembly monitoring reports that we receive from administration. And so I asked June if she would just show us exactly where those reports are and how we can find them. I know there's been a frustration, even with me. I will contact her and say, I can't remember when we saw this report. And generally what I have to do is go back and start searching for when did that occur. She's creating a filing system. So I'm going to turn it over to you, June, and have you walk people through it.
Thank you, Patty, or thank you, Ms. Manser. So the first thing, when you walk into documents and you can you see my screen open and when I work on it? Into documents, you see all the files, the folders that exist. If I open Blueprint 2030, you can see the files and the folders in Blueprint 2030. I would say when you're looking for a document, go to search, type in what you're looking for, click on documents and search. It'll take you to all of the files where those documents exist. And then you can open up those documents and it's all right there. That's really the easiest way. Let me go back to documents and show you what I've done for the policy monitoring workshop. You see the folder. Double click on the folder. We are in 2020. So these are listed by board policy. 1.1, this is student services. 1.1 here is iReady APR. It also includes Senate Bill 319. And so they're all listed here in the file, and just double click and you have that policy monitoring report. Right there, as you scroll through it, you'll be able to open the document and look at all of the files. Let me go back. Okay, so that also includes the business meeting slide deck. Now, with the business meeting, this is the complete slide deck, but on some of these business meeting PowerPoint slideshows, we do have policy monitoring. So you can see the board policy monitored, board policy, the number, and what is being discussed. There are quite a number of documents in here. This is probably the most cumbersome file because I've just taken all of the documents from the Friday updates and put them in here. I'm right now organizing those documents. You can also see all of the superintendent updates here. And these are listed under the year. Questions?
Jen,
No,
this
this
is,
looks great.
oh, go ahead, Jen.
No, I just wanted to say this is wonderful. What I noticed when you did the search, it seems, I mean, that's always been my, or I think our Achilles heel was the search. Would it identify certain keywords? So I'm hopeful that this is going to be what I use now when I'm like, oh, I remember it had this in it, and I can just kind of actually just search documents. So thank you for organizing this.
And that search window, Jennifer, if you do like Blueprint or just a phrase, you can look in the meetings or the documents.
Wow.
Great.
Let me go back. Nate, you had a question.
Other questions? Yeah.
Yeah. Hey, Jen, thanks for this. I think this is a great start. I'm eager to kind of get in there and play around a little bit. A couple of questions, or definitely one question. How far back do we have these documents for? So thinking about systems analysis, for example, and I don't know when the systems analysis was first done, but I did do a search on systems analysis and got something back from 2020. I'm certain that it was done before then originally. So how far back are we able to search?
Right now, you're able to search what documents were given this year. So we're talking about this school year. The goal, once I get this all organized, is to start going back year by year and picking up. And remember, I've only been here since 2018. So I only have the documents through 2018.
Jim, so can I ask a clarifying question based on Nate's question? So you're saying everything from what, August 1?
From July 1.
July 1, we would be able to find at this point, and then you are going to work your way backwards from there.
That's correct.
Okay.
But only to 2018. So is there sort of a phase 2 of this project to go pull in documentation from prior to when you started, June?
There is. And I will be finding that documentation. A lot of it is located in this file right here. This is the archive file from board docs. And so I'll be pulling a lot out of this. This is really a cumbersome file. So I'll be breaking that down and then pulling out like strategic plan, finding what are those things that you really want to know, strategic plan, curriculum, enrollment. What are the things that you really want to know? And then pulling those documents and putting them in here by date.
Gotcha. Awesome. Cool. Thanks.
And, just to remind everyone, when the board went from board docs to Assembly, it took a few months because we had to make sure that we could archive, that we wouldn't just by virtue of leaving the board docs platform, that board docs would make it possible. And we worked through Joe Phillips and his smart team in order to have that archived, because there was a lot of fear of letting go of that and then losing all of that content. Board docs was the system that had been used for a very long time. So that's really important that we have that, but it's kind of like going through your old shoe closet, or if anybody has a closet in the attic like I do, then you know how intimidating it could be. But I think this is really great. I hope everybody will sort of play around in it so that we can make sure this is feeling comfortable for us. But I have struggled for a long time to remember, when did we have that conversation? When did we get that PowerPoint? And so I'm hoping this will help with that.
Hey, Patty, one thing from my end. I was playing with it last night, June, and I don't know what the solution is, but it seemed like it wasn't searching through files that were attached unless it was named within the PDF document. And I have no idea how to figure out that solution. So just something
find out.
And how we can modify, or I honestly don't know the solution, whether they're open PDF docs so that it starts to peruse the text. but just a concept idea.
Okay.
Okay, and I am welcoming any ideas on how this would work better for you if I organized it differently. Just let me know. I'm kind of trying to find the largest common denominator on these items and just throw them in a category.
Well,
And
oh, sorry, go ahead, Jen.
go ahead.
I was just going to say, I wonder if, and maybe you're already doing this, but partnering with Joe and team to tag documents. And I don't know how that would work with whatever application we're using here, but it kind of goes in line with Manny's point. So, I just did a general search on Lincoln and nothing comes up. And we know we've got plenty of like decks and stuff that have Lincoln. So if there's an automated way to scrub the docs, pull the text out, and then we can tag, or maybe something, I don't know. But I think it kind of takes it to sort of that next level of usefulness if we can see it in that way.
Okay. Thank you. I'll work with Joe and his team on that.
Yeah, we'll be happy to help. We can do a OCR meta tagging project to make this happen.
Thank
There
you.
it is. Optical character recognition. For the
yes.
Thank you so much. Any other questions for June or kind of feedback initially?
Please play around with the program, excuse me, and know that the policies are listed here. If you need to know what are their administration or board policies, they're listed here. I have a few more things like meeting and work in progress. You won't see that, but let me know if you have any questions.
Thank you so much. I think this is a good, healthy start for us. And if we have an organized filing system going forward, and if we can get some tagging mechanism in place for commonly reoccurring topics, that would be really useful. I think one other announcement I wanted to make is that, it sort of was brought to my attention the other day that because the Board of Education is going to remain effectively closed for, groups and our buildings are closed to groups, our first board meeting in June will be June 10th. And that board meeting was supposed to be an off-site board meeting. And we had planned to go to J. Rogers. And so I reached out to Marvia Jones and let her know we will obviously not be taking our show on the road to J. Rogers on June 10th, but we will, when it's safe and appropriate as the new school year gets underway, we will think about, how we restart that process, because it is a very popular one for building principals and staffs and communities that surround those schools. So we will figure that out, but we will not be doing the June 10th meeting off-site or at a school building. Given Dr. Bedell's recommendations related to the timed and scheduled reentry starting in July, at this point in time, as we talked with administration yesterday when they were sharing that plan and their initial thinking, it looks to us at this time, we know that our next probably 2 meetings at minimum will be held using this current form, and may even, depending on where things are after June 10th and 24th, we get a little gap, and then our next meeting will be July 22nd. So we'll play that by ear, but we need to plan that for this period of time through the end of June, our public board meetings will be held via this forum. Any thoughts or comments on that? All right. I don't have any other items at this moment unless I've overlooked something, Nate and Manny.
I don't think so.
All right. So folks, we are going to conclude this meeting. And June, everybody has a link to log back in at 6 p.m., correct? I've
Yes, I
lost-
believe everyone has that.
Okay, so we are going to adjourn this meeting and we will rejoin at 6 p.m. And that's going to be our board budget hearing. And Mr. Abarca and his expert team are going to lead us through that conversation and the public comment component. And thank you to IT for helping us with that. Is there anything, June, that I need to let everyone know?
I think that's everything right now.
And Joe will open the line a little early, so it's not just opening promptly at 6 o'clock and people are worried about, I can't get in. So, but you do get a brief break. So with that, yes.
Can we stay on the line?
It is a new link, correct, June?
That is correct. You need to click on the new link for the 6 o'clock meeting.
All right, Ms. Master, just before the board goes, and I can mention this again out in the open, we have a couple of lengthy presentations tonight. And what I think this screen time, it takes a toll on a lot of us. And I talked to my team, our regular monitoring update is pretty lengthy, and we tried to figure out what could we pull out. I think everything in there is essential. Shannon Jacks, along with Kelly, will be doing the Blueprint 2030, and we know we have a workshop coming. We talked to Shannon, and I think there are some things in there where there's some, it's updated. You all have seen a lot on some of the system analysis work that we've done, and we've updated some of those slides with some new data that I personally think we can cover when we do our workshop on the 3rd. I want to be respectful for the presenter. I think by the time we get to her, there are essential things that she needs to be presenting that's new information for you all, the information directly from the stakeholders that we met with, the information that we got from the surveys from the middle schoolers, and then the highlights of some of the internal assessments that we've done. But there's a lot of updated information just from a data standpoint that I told her, I really believe we don't have to utilize and go through those slides because you've seen a lot of it. We want to do that on the 3rd, just so that we can make sure that people aren't checking out on us or burning out because of the amount of screen time. So I just wanted to let you all know, I talked to Ms. Manser about it. I talked to Shannon Jacks about it. And we think after doing our review this morning, that's probably the best case scenario. I think it's fair for everybody.
Thank you, Dr. Bedell. With that, let's adjourn and then we'll see you in a few minutes.
All right.
Thank you, everyone.